Good afternoon everyone. I am Darshana from 2nd year 2A Ocean International Medical University. Today we are going to discuss about the drug tamoxifen. In this lecture we are going to discuss about the class, therapeutic effects, side effects, adverse effect, etc. Okay, we can go to first about the class of this drug. Tamoxifen is coming under a class of selective estrogen receptors modulators, SERM, the most important drug worldwide for hormone receptor positive breast cancers. Next, the mechanism of action. Tamoxifen competitively inhibits estrogen binding to its receptor, which is critical for its activity in breast cancer cells. Tamoxifen leads to a decrease in tumor growth factor alpha and insulin-like growth factor and an increase in sex hormone binding globulin. The increase in sex hormone binding globulin limits the amount of freely available estradiol. These changes reduce level of factors that stimulate tuber growth. Then therapeutic uses. This drug mainly used for breast cancer, treatment of breast cancers, then premature puberty, prevent gynecomastia in patients undergoing prostate cancer therapy, and infertility. What is meant by gynecomastia? Gynecomastia is an overdevelopment or enlargement of the breast tissues in men or boys. This is due to the changes in levels of female hormones like estrogen and the male hormones testosterone in their bodies. Next, we are going to discuss about the side effects of the drug tamoxifen. Menopause-like symptoms including hot flushes, night sweats, and vaginal dryness. Weight gain, most common side effect, leg swelling, nausea, increase the risk of thromboembolism events. Then adverse effects. The most serious adverse effect of the tamoxifen drug is it causes endometrial cancer. In rare cases, blood clot in legs also causes. Then contraindications. You should not take tamoxifen if you have a history of blood clots or take blood thinning medicines. Tamoxifen increases the risk of blood clots. Not take tamoxifen if you are breastfeeding or pregnant or trying to get pregnant, or if there is any chance that you could be pregnant. The last about this drug is drug interactions. Other medicines can affect the removal of tamoxifen from our body. Mainly some antidepressants cause the effect of tamoxifen in our body. Then thanks for your attention.
Good evening everybody. My name is Amisha. I am the student of Ocean International Medical University. I am in 2nd year 2A group. Today we are going to discuss about a drug called hydrocortisone. In this lecture, we are going to tell about its class, mechanism of action, diagnostic uses, therapeutic uses, side effects, adverse effect, etc. So let's get started from the classes. Class of hydrocortisone. Hydrocortisone is in a class of medications called corticosteroids. It works by the activating natural substance in the skin to reduce swelling, redness and itching. Next is mechanism of action. The mineralocorticoid, aldosterone, and the glucocorticoid, cortisol, and the corticor are produced uniquely in the adrenal cortex. These steroids act by binding to intracellular receptors, which then act to modulate gene transcription in the target tissues. Therapeutic uses. Hydrocortisone is a steroid medicine. It's called corticosteroids. It works by calming down your body's immune response to reduce pain, itching, and swelling called inflammations. It is also used to be a hormone replacement for people who do not have enough of natural stress hormones like cortisol. Diagnostic uses. Hydrocortisone tablet work as a hormone replacement for a natural hormone called cortisol. You may take hydrocortisone tablet if your body does not make enough cortisol. For example, if you have addiction disease or if you have your adrenal glands take out, you can use this medicine. Side effects of the hydrocortisone. The most common side effects of hydrocortisone tablets are feeling dizziness, headache, swollen ankles, and feeling weak or tired. Taking hydrocortisone tablet can affect your immune system, so you are more likely to get infections. Adverse effects. It can cause serious side effects such as adrenal glands problems, high blood sugar, hyperglycemia, like that, or problems with your eyesight. It will affect our eyesight also. Contraindications. Inactive tuberculosis, herpes simplex infection of the eyes, an infection due to a fungus, intestinal infection caused by the roundworm strongyloids, a condition with low thyroid hormone level, insufficiency of the hypothalamus and pituitary glands. Drug-to-drug interactions. You should tell any doctor or dentist treating you that you are taking steroids. Some key drugs that interact with steroids including anticoagulants such as warfarin, drugs for blood pressure, antiplatelets, antidiabetes drugs, antifungal drugs, bronchodilators such as salbutamol, and diuretics. Thanks for your attention. Thank you so much.
Hello guys, greeting. I am glad to introduce myself. I am Abdul Basit from 2A group, OSHIMU. Today topics we have seen diclofenac. Scientific name is diclofenac sodium and its chemical formula is C14H10 Cl2 NO2 Na and its average molecular weight is 318.1 AMU and drug category is non-steroidal anti-inflammatory agents NSAID. Non-steroidal anti-inflammatory drug and it treats pain and inflammatory diseases. Next we see about mechanism of action. It inhibits prostaglandin by inhibiting cyclooxygenase 1 and cyclooxygenase 2 with relative equipotency. Next we see about uses. It uses treat ache and pain and problems with joints, muscles and bones. Example, rheumatoid arthritis, osteoarthritis. Next we see about dosage. Adult and children 25 milligram 4 times a day. Children below 12 years, dosage based on level of pain. Next we see about side effects of diclofenac. Feeling sick, diarrhea, headache, mild rashes. Next we see about interaction. Aspirin. When taken with diclofenac, aspirin's efficiency is reduced. Antithrombotics, example, warfarin, clopidogrel, anticoagulants and antiplatelets. It increases the risk of serious bleeding. Next one is lithobyte. When taken with diclofenac, it reduces lithobyte's absorption in human body, thus forming lithium toxicity. Thank you guys.
Greetings guys, myself Sri Shivashakti from 2A group. Today we have to see about aciclovir. In aciclovir there is class and structures, pharmacokinetics, mechanism of action, uses, dosage, side effects and interactions. Firstly, the class. The class is imidazopyridates, the subclass is purines and derivatives, and secondly pharmacokinetics. In pharmacokinetics it is a route of elimination. The route of elimination is kidney and less water soluble and less oral bioavailability like 15 to 13%, and half-life is equal to 2.5 to 3.3 hours. And third, mechanism of action. The mechanism of action, aciclovir plus ATP, it produces aciclovir phosphate. Through aciclovir phosphate, we get aciclovir triphosphate. Through aciclovir triphosphate, we get aciclovir triphosphate incorporated into viral DNA. As a result, we get viral DNA synthesis inhibition. And fourth, the uses. The uses is less pain and increased speed of healing in sores and blisters in. There is varicella and chickenpox and herbs zosters. The fifth one is dosage. We have to take oral 400 mg per hour. And the fifth one is dosage. In oral, we have to take 400 mg in 8 hours up to 7 to 14 days. As IV, as an injection, 5 mg per kg in 8 hours up to 7 to 14 days. And then side effects. The side effects is nausea, vomiting, diarrhea, and abdominal pain. And the interaction is mainly with the cidofovir, increase kidney damage. It may increase the kidney damage, and if we want to take cidofovir, we have to wait 7 days before using the tablet. And with the diazonide, increase blood level and affect the diazonide. Is the blood pressure to fall. In case the patient dies from the sitting, it decreases the blood pressure and dizziness and lightheadedness. Thank you guys.
Hello everyone, this is Dr. Shakti Sri. Now I am going to give you a presentation regarding amoxicillin. Do you know what is amoxicillin? Yes, amoxicillin is a drug that is used to treat bacterial infections. Amoxicillin is the extended spectrum antibiotics, which you may know already. Now I am going to explain about mechanism of action of amoxicillin. That is, amoxicillin is a drug which is similar to penicillin. Like penicillin, it is exactly similar to penicillin. It is used for bactericidal action through active multiplication. It acts through inhibition of cell wall biosynthesis, which leads to the death of the bacteria. Therapeutic uses. The therapeutic uses are chest infection, that is pneumonia, dental abscess, stomach ulcers, ear, eyes infections. These are the therapeutic uses of amoxicillin. Then we can see diagnostic uses of amoxicillin. That is, it is used to cure pneumonia, that is inflammation of lungs, bronchitis, that is inflammation of bronchial tubes, then ear, nose, throat, and it is also given in combination with other drugs to cure urinary tract and skin infections. That's all about diagnostic uses of amoxicillin. Then we are going to see about side effects of amoxicillin. If you are taking amoxicillin for a long time, it will become resistant, and it will not give us result of the disease, that it will become resistant to the disease. That is, side effects are nausea, that is vomiting. It is the most common side effect of amoxicillin. Next, diarrhea, skin rash, that is like reddish appearance in skin and other skin related problems. And then headache. Taste, we can't find the taste of the food, that is taste. We can't find. Smell changes, we can't smell anything properly. And then allergic reaction. Next, we are going to see about adverse effects of amoxicillin. It causes rash, dizziness, nausea, diarrhea, or yeast infections. Most serious side effects include low serious difficult infection which causes diarrhea that lead to severe colon damage and death. Next, we are going to see about contradictions of amoxicillin, that is hypersensitivity, cephalosporin hypersensitivity. Amoxicillin is contraindicated in patient with serious hypersensitivity to antibiotics or to other drugs in some class, that is penicillin hypersensitivity, or patients who have demonstrated
About the drug zithromax or azithromycin. First, we can see about the class. It's belong to the class of drug known as macrolide antibiotics. It is working is by killing the bacteria or preventing their growths. And then we can see about the mechanisms of actions. It blocks the protein synthesis by inhibiting the transpedition or translocation steps to the protein synthesis. Ribosomal subunits. And then we can see about the therapeutic uses. It is used to treat certain bacterial infections such as bronchitis, pneumonia, and then infections of ear, lungs, sinus, skin, throats, and reproductive organs. We can see about that azithromycin nowadays we can use it about antibiotic. It's most common in for cough and something else, but we can use mostly azithromycin for this tablet. And then we can use we can see the side effects. We can commonly use in side effects of azithromycin is happens in more than in 100 people were used. What are the side effects? Feeling sick, diarrhea, vomiting, and then appetite, headaches, feeling dizziness or tired, changes to sense of tastes, and this is a common side effects of azithromycin. And then we can see about the serious side effects of azithromycin is tinnitus, vertigo, bronchitis, anaphylaxis, irregular heartbeats. This is and then we can see about adverse effects in azithromycin. The most serious allergic reaction includes anaphylaxis, angioedema, and then we can use the contraindications. It is the contraindications in patients with the history of severe hypersensitivity to azithromycin or another macrolide antimicrobial. In addiction, clinicians should be cautious regarding the uses of azithromycin. Azithromycin is the contraindicated for patients taking the first generation antipsychotic bromide. Macrolide antimicrobial inhibits the same cytochrome, the metabolism pyramid. And then drug, we can see about that drug interactions. Azithromycin may interact with other medications a person is taking. For example, using azithromycin while taking nelifenavir, which a drug helps to treat HIV, can increase the risk of liver abnormalities and hearing problems. And then azithromycin can also increase the effects of blood thinners such as warfarin. Other drugs that may interact with azithromycin includes digoxin, a heart medication, colchicine, a gout medication, penitoin, a seiture medication, anatite that contains magnesium or aluminium. This is about we can see in this video about azithromycin. Thank you for making this video.
Good evening, everyone. A warm greetings and welcome from my side. Myself, Kirtana, belonging to Group 2A of Osh International Medical University. Today, I'm going to present this presentation of azithromycin, and I'm presenting this presentation to my teacher, Dr. Faisal sir. And in this presentation, I'm going to talk about azithromycin, the class of the drug, source, action, indication, dosage, clinical application, uses, mechanism of action, therapeutic use, diagnostic use, effect of drug, contraindications of drug, pharmacokinetics, pharmacodynamics, drug-to-drug interaction, process of absorption, bioavailability, and half-life. So, firstly, what is azithromycin? Azithromycin is a widely used antibiotic against many microorganisms, including Staphylococcus, and mainly it has a wide spectrum of pharmacokinetics, better tolerability, and drug interaction amongst them. And it is mainly used against curing many of the infections like bacterial infections and even sexually transmitted diseases. And the trade name of this drug is Zithromax, Acithromycin, and others. The other name of this azithromycin is 9-deoxy 9-alpha aza 9-alpha methyl 9-alpha homoazithromycin A. The route of administration. Azithromycin is given by mouth, that is in the form of capsule, tablet, or suspension. Then it's given in the form of IV injection, and even in cases of eye infection, it is given in the form of eye drops. The class of this drug include macrolide antibiotic. The bioavailability of this drug includes 38% for each 250 mg of capsule, and the metabolism mainly occurs in liver. The elimination of this half-life occurs generally from 11 to 14 hours for a single dose, and it widely differs from for multiple dosing among 68 hours. And the excretion is done in the organs like bile, duct, and kidney. The formula for this azithromycin is C38, H12, N2, and O12. The molar mass of this azithromycin is 748.996 gram mole inverse. The 3D model is interactive image. First, we're going to talk about the class of drug. The class of drug includes macrolide. The macrolide or class of drug that are used to treat many bacterial infections, and they are commonly used to treat infections like pneumonia, sinusitis, and tonsillitis. They are also used in uncomplicated skin infections such as otitis media in pediatric patients. And source of this azithromycin. Azithromycin is an azolite, a subclass of macrolide antibiotics. It is derived from erythromycin with a methyl substituted nitrogen atom incorporated into the lactic ring, thus making that lactone ring 15-membered. It prevents the growth factors. Actually, what it does is this structure of this azithromycin prevents the further growth of this bacteria. Action of this drug. It includes the inhibition of bacterial protein synthesis. This action of this drug, what it does is actually it will go and kill the bacteria, and it will thus it is preventing the further growth of this bacteria. Thus it mainly involved in the cytokine protection, and it inhibit the neutrophil infestation and macrophage polarization. And alteration given it has the ability to act against a wide range of microorganisms. This azithromycin is used against a wide range of microorganisms. And indication of this drug. The other indications of drug of azithromycin includes tonsillitis, sinusitis, and others, and they are mainly used in
sensitivity. Next, now we are going to see about drug-to-drug interaction of amoxicillin. Amoxicillin can interact with medications like warfarin, allopurinol, probenecid, alcohol, and live vaccines. Make sure to provide an updated medication list to your healthcare providers and pharmacists. This will help them check for amoxicillin interactions. Thank you for your cooperation.
Welcome to today's topic. Today's topic is lignocaine. Lignocaine is also known as lidocaine, a local anesthetic used as topical and injective form. Similar drug or equivalent drug is mipovacaine. This lignocaine is the widely used local anesthetic. Lignocaine is the fast and long-acting local anesthetic. It is useful for all type of blocks. Maximum anesthetic effect is seen in 2 to 5 minutes and lasts for 30 to 45 minutes. Action prevents the propagation of nerve action potential. Blocks small diameter pain fibers at lower concentration than large fibers. Vasodilation occurs in the injected area. Mechanism of action. Use dependent block of voltage gated sodium plus channels from inside of cell membrane. Penetrate cell membrane in its lipid soluble uncharged form. Less active in inflamed tissue where the lower pH increases ionization of the weakly basic local anesthetic. abstraction, distribution or elimination. Topical application or injection. Topical application in forms of gel, solution, ointment, patches, etc. Penetrates membranes readily. Lidocaine, like other amide local anesthetic, is metabolized mainly in the liver by P450 system. Clinical use: surface and infiltration anesthesia, nerve block, example dentistry, and epidural and spinal anesthesia. Adrenaline may be added to reduce loss to bloodstream. EMLA is a widely used topical combination of lidocaine with pyrilocaine, used in ventricular dysrhythmia in MI, that is myocardial infarction. Adverse effect: in contrast to other local anesthesia, may be added to reduce loss to bloodstream. EMLA is a widely used topical combination of lidocaine with pyrilocaine, used in ventricular dysrhythmia in MI, that is myocardial infarction. Adverse effect: in contrast to other local anesthetic, lignocaine causes drowsiness and mental clouding. Though it is a good corneal anesthetic, lignocaine is not generally preferred because it causes irritation. Toxicity of overdose: causes muscle stretching, convulsion, cardiac arrhythmia, fall in blood pressure, coma, and respiratory arrest. Preparation: available as 4% topical solution, 2% jelly, 5% ointment, 1 and 2% injection, 5% for spinal anesthesia, and 10% spray. Ways lignocaine reduces the transmission of pain to the CNS. It may be used as surface anesthesia, infiltration anesthesia, and nerve block. It is also used as epidural anesthesia and spinal anesthesia. Thank you.